Greetings, everyone. My name is Shubhayu Saha, and I work as a health scientist with the Climate and Health Program at the Centers for Disease Control and Prevention. I welcome you all to the second webinar in the Climate and Health webinar series that the program is hosting. Just a couple of housekeeping items before we proceed. Please submit your questions through the question answer section, question answer box that you see on the Zoom platform. We would start the webinar with remarks from each of our 5 panelists and then open it up for question and answers at the end of all the presentations. Next slide, please. So one motivation behind the organization of these webinars was to address a topical public health issue that is critically impacted by climate change. We intend to invite experts from academia, civil society, and government agencies to present a diverse set of perspectives on the salience of the issue, how the current concerns get amplified in the years to come under climate change, and solutions that we have or those we need to safeguard the long-term welfare of anybody in the country. So in that context, the spring season comes with the heightened concerns of pollen exposure. In this webinar today, we are trying to connect the dots on the evidence linking the changing climate with increasing pollen concentrations, different approaches used to monitor pollen concentrations, ways that the public health and the clinical community is addressing the health risks from pollen, and how we can harness the emerging interdisciplinary science to provide timely information on health risks from pollen exposure. So without further ado, we will move into the remarks from our panelists. Next slide, please. And so the first panelist, we are very lucky to have Dr. Louis Ziska. Dr. Ziska is an associate professor at the Environmental Health Sciences Department at Columbia University, where he examines the nexus of climate change, carbon dioxide, plant biology, and public health. Thank you so much, Dr. Ziska, for joining us. Next slide.
Thank you so much for having me. I'm seeing a picture of this meeting is being recorded on my screen. Do you have that as well? Okay.
That sounds right.
All right. Let me take you on a long and strange journey with me. It's a personal journey. It's a science journey, but I hope you'll find it interesting. Back in the late 1990s, I was a weed scientist for the U.S. Department of Agriculture, and I was very interested in looking at the effects that weeds might have on public health. And in that regard, I decided to look at the role of ragweed pollen production in the context of rising carbon dioxide, with carbon dioxide being recognized as something that stimulates the growth of plants. So here we are collecting pollen from different ragweed catkins. Next. We were able to show that, in fact, more CO2, both in this chamber study looking for recent changes from 280 parts per million to 370, had an increase in terms of the dry weight per plant, but also when we went to 600 parts per million, it also increased the dry weight. And in addition, it also increased the pollen production, doubling from about 280 to 370, doubling again, going up to 600 parts per million. So this was a chamber study. It was very interesting, but I ran into two problems. The first problem is my supervisors didn't like the study, and I was reprimanded for it because I was told specifically that this was not a quote unquote agricultural study and that plants had nothing to do with public health. The second problem I had was a bigger problem because I wanted to keep doing this. I wanted to do more of this, and I wanted to do it in a way that would not just be a laboratory study, but would also try and sort of look at it from a real world in situ kind of perspective. Next. So that was difficult. We had the Duke Forest, which just disappeared from the screen, but that was a face system that was looking at how different carbon dioxide was going to affect the role of plant growth for loblolly pine. But it was a very expensive system. It cost literally millions of dollars to do. And my entire budget, my discretionary budget was $3,000. So well, the necessity is the mother of invention, but perhaps poverty is the father. In any case, what I had to come up with was a way to take this and make it real in a real world situation. And it occurred to me in looking at the Keeling curve, that is the long-term record we have of carbon dioxide, that there was something odd about that. What was odd about it was that it was being taken place in Hawaii. Now, I mean, okay, Hawaii, any scientist would want to go to Hawaii. They've got, you've got your daiquiris, you've got your luau's, you've got your beach parties and so forth. But why Hawaii? Well, it turns out next that, of course, Hawaii is the most geographically isolated spot on Earth. And there's a reason why they monitor carbon dioxide there at 10,000 feet at Mauna Loa, because it's not being affected by what we're doing here at the street level, right? And once I realized that, I thought there was another way to approach this. Next. And that is to use a urban-rural microclimate difference in terms of temperature and carbon dioxide, going from a rural organic farm in Western Maryland to downtown Baltimore. And for each site, we dug up the common soil with the same seed bank from our farm, and we moved it out along the way. And we decided that we would look at what came up from that soil. And fortunately for us, next slide, one of the things that came up was ragweed. And so when we looked more closely at ragweed in this urban-rural transect, this microclimate difference, we were able to see that ragweed pollen at the rural site, this is just looking at grains per cubic meter, days of year. So January 1st is day 1, December 31st is day 365. And of course, ragweed being a short day plant, flowers in the fall. And that's the first farm site here. So you can see that basically we're getting, pollen produced, going up, maximum going down. When we went to the suburbs, however, we saw earlier pollen formation. These two arrows basically are representing the beginning and maximum peaks from the rural site, the sort of control in this case. And then even more interestingly, when we went to the urban site, which has the warmer temperatures, more CO2, longer growing season, in other words, all of the things that we anticipate with climate change, we were able to see almost a 10-fold increase in terms of pollen production per plant. Cool, right? This is now going out into the real world. And by the way, I got a grant to do this, so my supervisors were not as unhappy as they were before, just saying. All right, so next slide. So it's a global problem, however, right? We've got to go beyond this. Next slide. So how do we do that? Well, then it gets really tricky, because if we want to do it on a continental level, who are you going to call, right? So it turns out that we called that various allergists in the center of the country. And it was a lot of, picking up the phone and going, hi, you don't know me, but I'm really interested in looking at climate change and pollen. No, don't hang up, don't hang up, don't hang up. Okay, wait, no, next person, and so forth and so on. So we did enough of this until we got some brave souls who were really interested in what we were doing. And then we ran into another problem. It turns out that Burkhards and rotorods, which are the two main methods of collecting pollen, don't really agree with each other in terms of numbers. So it's hard to collect, compare one with the other. But we did find that they both start collecting pollen at the same time and stop at the same time. So okay, well, let's focus now on seasonality, right? So we wanted to look at it from this perspective. We know that climate change is causing temperatures to increase not uniformly, but different areas are warming up faster than others. And we know that's a function of latitude. The more you move toward the poles, the faster the rate of warming. So if that's true, then we should see a change in pollen seasonality as we move from the southeastern Texas to southern Canada. So next slide. And that's pretty much what we did. And we saw that, in fact, this was occurring. And it wasn't just occurring in the future, it was actually happening in real time, going from the early 90s or mid 90s to the early teens. And so we were able to show from now, we've gone from the chamber, we've gone to the city, we've gone to the continent. And now we're seeing some real interesting data that suggests that pollen metrics are being altered both by carbon dioxide and by seasonality associated with climate change. Next. And a quick shout out to Kim Knowlton, Christine Rogers, Francis Coates. These guys were tremendous in terms of helping us answer the phones and to get this thing going. Next. So we wanted now to go to the next step. Let's look at it from a global perspective. And so we got on the phone and email and texting and IM and all that fun stuff. And we started asking folks, do you have a 20+ year record of pollen where A, you've kept the same methodology has been used throughout, B, you haven't turned it on day one and turned it off on day X, following a prescribed thing year to year, that you're actually monitoring when the pollen first shows up and when it ends, and so forth and so on. And here's what we saw. The longest record we had was Turku, Finland, going back to the 1970s, showing a change in seasonal pollen over time. Next. And this is Reykjavik, Iceland, showing a change in seasonal pollen over time. Next. This is Geneva, Switzerland, same thing, and we can go on. So basically, we were able to find a number of different sites that had these metrics that we could then exploit to look at it from a temperature lens. Next. And that's what we did. We looked at it from both a maximum temperature, changes in maximum temperature over time. How are those temperatures changing, the slope of those temperatures, and then related it back to different pollen metrics. In this case, for this figure, we're looking at pollen load, the amount of pollen being exposed over a period of time. Now, there are limitations to this approach, especially when you start looking at it from a decadal point of view. There's going to be demographic changes in plants that are known to produce allergens and so forth. So it's a little bit sketchy, but there is a relationship there. There's some statistics to point out and say these are significant and worth looking at. Next. So again, now we're gonna go and dig a little deeper, and Bill Anderegg at University of Utah and Pat Kinney and others have been helping us with this, or helping our group of us. And so what Bill did is to really look at it and say, can we separate the climate aspect, the temperature aspect, from other aspects that might be going on here? Is there a clear climate signal, perhaps not a deterministic signal, but a probabilistic signal that we can see? And this just, I think, came out a couple of months ago in PNAS, showing that this is in fact what we're seeing, that there are changes in terms of start days, changes in terms of pollen load that are being picked up in North America that are specific to climate change. Next. So this is just the PNAS article for further reference. Next. And finally, we're not done. There's a lot going on here. And one of the more interesting things that we've been looking at is actually work that's being done by medical professionals that are in that part of the world in Eastern Europe that are looking at pollen as something that is affecting the epithelial cell immune response, in the sense that when pollen comes into contact with those cells, the interferon response is altered in such a way that, in fact, the susceptibility to respiratory viruses, in this case, COVID, may be changed, so that the ability of you to get COVID may increase as a function of your exposure to pollen, whether you're sensitive to pollen or not. And next slide. And so this is, some of the work that was done by Stephanie Giles, suggesting that the high, extensive outdoor activities when pollen and respiratory virus can coincide. It's an initial toe in the water type arrangement. We need to get a lot more work done. What specific pollens produce the same degree? We don't know. This is mostly on birch pollen, but there's a lot more left to do. Next. So could temporal and spatial intensity of seasonal allergies influence respiratory virus metrics? Stay tuned. We ain't done yet. Okay, I'm done, but the research isn't done. All right.
Thank you so much, Dr. Ziska. Next slide, please. So next we have Dr. Theresa Crimmins. Theresa is the director of the USA National Phenology Network and a research professor at the University of Arizona. Her research focuses on drivers to plant phenology, plant phenological response to changing climate conditions, and patterns in citizen science program participation. Thank you, Theresa.
Thanks, Shubhayu. Next slide. Oh, well, next slide. So since the word phenology is in our organization's title, I always like to start by defining it to make sure we're on the same page. Phenology is an old-fashioned word for the seasonal phenomena with which we are all so familiar. It's things like when is the tree in your front yard putting on its leaves, and when the timing of pollen is in the air. When these events occur from year to year is strongly influenced by local conditions, such as how warm it's been recently or how much rain has fallen. And as such, the timing of seasonal events can vary, sometimes by a lot from year to year. And as Dr. Ziska just pointed out to us, as climate conditions are changing, the timing of events of leaf out, things like leaf out and of course pollen in the air, are changing too, and in some cases by a lot. Next slide, please. However, our collective knowledge about how the timing of seasonal events like leaf out and pollen in the air are changing, and perhaps more importantly, what the consequences are of these changes are still fairly limited for the most part. So to help fill this information gap, the USA National Phenology Network was established back in 2007. And our primary aim is to collect, store, and then freely share data and information about when things are happening seasonally in plants and animals across the country. And we make these data and data products available to help advance our fundamental scientific understanding of what drives phenology and how it's changing, to support a wide range of decisions in both natural resource management and now more in human health and other sectors. We also communicate and connect with various audiences about what the heck is phenology and why should we care and why does it matter. And then finally, we are also trying to ensure that the activities of our network, which are federally funded, are equitable, inclusive to citizens and inhabitants of the entire country. Next slide, please. So the primary way in which we accumulate information about phenology and when things are happening from season to season and across the country is through a program, a community or citizen science program known as Nature's Notebook. And if you go ahead and click the animation real quick here, what the core of this program is a series of standardized protocols that have been scientifically vetted by the science community to enable observations by non-scientists that are of sufficient rigor and quality that they can be used in science and management. And basically these protocols necessitate that observers are making repeated observations on the same individual plants over the course of the season. And each time they're making an observation, they're answering a series of questions phrased as yes or no questions about what they see happening on that plant. Or again, we have these for animals as well. And so what this yields is a temporal record of when things are happening, and by extension, when things began and when they ended. And then we also have some information about the intensity or abundance by which a particular event is being expressed. We also offer extensive training materials and support for participants, again, in service of trying to get data of sufficient quality and rigor. And the program is available through mobile apps or through an online interface. Next slide. A kind of a unique feature of Nature's Notebook is that participants can become involved as an individual, but we also have a pretty extensive mechanism by which members of a pre-existing group can participate as well. And so there's a number of organizations, things like docents at nature centers or members of academic institutions participate in this way. We also have land management units leverage this quite a bit. We have quite a few National Park Service and Fish and Wildlife Service units that participate in this way. And one of the big reasons this emerged is that we really encourage everybody who participates to do so for their own reasons, because they are interested in understanding how things are changing at their location and why, rather than having it be for an altruistic reason of just simply contributing to a broader program. We like that too. And we offer a formal training for leaders of groups, again, also in service of ensuring good, sufficient data rigor. Next slide, please. So this slide just quickly shows the density and spread of the data that we have amassed since 2009. It's over 24 million records now across the country at 16,000 sites. One of the nice features is that we have the National Ecological Observatory Network participating, and their sites are some of the biggest bubbles on here. At the 60+ neon sites, plant phenology is being tracked and contributed to our database as well. Next slide. And these data have been used in over 100 different peer-reviewed publications since our program established. And these tend to be for uses like understanding the drivers to phenology, meaning what are the cues that trigger things like pollen release or leaf out in different species, because it's not often actually really that well known. In documenting how phenology is changing, which is kind of an obvious use. And then finally, the data are also frequently used as ground observations that can be interpreted alongside of information collected on sensors that are mounted on satellites and planes. Next slide, please. One of the things that I wanted to mention, one of the primary ways that we collect data on different species or seasonal phenomena is through these data collection campaigns. And here are some of the various campaigns we've hosted over the years in collaboration with researchers and other partners. And I wanted to mention that today here because we could consider running a campaign focused on collecting observations of flowering in key allergenic species, because that's the sort of thing that could get more data to specifically fill gaps in areas that are not well instrumented or where we just want to know more about the seasonal pollen dynamics at a location. Next slide, please. And so you may be wondering, are the phenology observations that are collected by volunteer participants in Nature's Notebook any good at actually characterizing the dynamics of the pollen season? So I want to briefly show some preliminary analyses from a study that a master's student in public health here at University of Arizona and I are undertaking, where we're comparing the tree pollen count data collected by National Allergy Bureau samplers to observations of open flowers contributed by Nature's Notebook observers. So what we've done so far is to compare the daily tree pollen count data just from the Waterbury, Connecticut station to observations of open flowers contributed to Nature's Notebook for key allergenic tree species that fall either within various buffer sizes. What we looked at was 50, 100, and 200 miles just as a start. And we are comparing the daily pollen counts to the fraction of observations for open flowers that are yes on a given day. So in this analysis, it's daily data. Next slide, please. And so what this plot shows is pollen count, the daily pollen counts in green from 2010 to 2019 in each of those three panels. And then the proportion of the open flower observations contributed by the Nature's Notebook observers that were yes on a given day over that same period within the 50-mile buffer in pink on the bottom, within the 100-mile buffer in gray in the middle, and then the 200-mile buffer in yellow on the top. And what we can see right away is that the pollen observations contributed by the Nature's Notebook observers definitely reflect the seasonality of the pollen season. We also see that things seem to behave better later in the record, which is not a surprise because we have more observers participating later in the record. One kind of interesting thing is that in some of the years, we can kind of see hints at a temporal offset where the peak in open flowers precedes the peak in the pollen counts. And this is something that perhaps has potential to be used in a predictive way. And then next slide, please. When we look at simple correlations between these two measures, the fits are not super strong, though for this station, the relationships were significant for observations falling within the 50 and the 200-mile buffer. I want to emphasize that these results are very preliminary and we're digging a lot deeper on this. And we've also put in a formal request to Quad AI to hopefully gain access to data from several more NAB stations and other regions to be able to include in this analysis. However, to me, these results suggest that there is potential in leveraging volunteer contributed observations of flowering as a way to strengthen our signal regarding the pollen season. And recall, these observations were collected rather passively. If we did mobilize a focused campaign and engaged a lot more observers in documenting the seasonal flowering, we might be able to tighten this relationship up more and possibly be able to use it in a predictive way. Next slide, please. And I know you all already know there is a market for even short-term forecasts, and the NPN, my organization, has had some success with forecasts for phenomena such as the biological start to spring being picked up by the news media. These screen caps show examples of where our start of spring forecast has been recirculated by local TV meteorologists, which happens quite a bit each spring, as well as the New York Times in the upper left corner and the Weather Channel down on the lower right corner. Next slide, please. So before I conclude, I want to bring your attention to a recent effort that's starting to take shape that's relevant here too. Led by the US Geological Survey, representatives from the National Atmospheric Deposition Program, the USA National Phenology Network, Ameriflex, Pollen Sense, and the Phenocam Network are developing a proposal to bring efforts of these networks together in a more formal way, with the aim of trying to link more specifically phenology to aerobiology and atmospheric monitoring. So we're envisioning an effort to extend monitoring in all of these networks, aiming to increase the number of locations where the various parameters are being monitored at the same locations. As well, each of these networks maintain data independently, but make the data available through APIs. And we would take advantage of this capacity to build out tools enabling users to explore measurements from the various networks together through maps and time series. So we're excited to expand this network and include others as it's in a very early stage. So if you have interest in learning more, please reach out and I'll be happy to put you in touch with this larger group. Next slide. And so with that, I will conclude, but I thank you very much and look forward to continued conversations.
Thank you, Dr. Crimmins. So next, we have Ms. Claudia Brown. Claudia is an epidemiologist in the Climate and Health Program. She works with state and city public health departments and partner organizations to improve access to pollen information to inform public health action. Welcome, Claudia.
Thanks, Shubhayu. Next slide. So today I'll be talking about some of the research being conducted by the CDC's Climate and Health Program on pollen and how we're using this information to better inform public health action. Next slide. So pollen has significant health and economic impacts, which is why it's important for us at the Climate and Health Program. Seasonal pollen causes allergic rhinitis, also known as hay fever, and this affects 30 to 60 million people in the US with a disproportionate effect on children. Additionally, seasonal allergies can exacerbate pre-existing respiratory health conditions such as asthma. Asthma, we know, disproportionately affects Black, Hispanic, and American Indian Alaska Native people, as these groups have highest asthma rates, deaths, and hospitalizations. And in a single year, Americans spent $11 billion on medical costs associated with seasonal allergies. And this does not include the indirect costs related to missed days of school and work. Next slide. And as some of the presenters have already mentioned, we know that pollen seasons are changing. A literature review we conducted found that across the world, warming temperatures are associated with pollen seasons that are starting earlier, lasting longer, and are more intense with higher pollen counts. Next slide. And we're seeing these trends across different species of plants. Here in Atlanta, working with Dr. Stanley Fineman, who will be presenting later, we found that the average daily pollen count during the pollen season has increased over the years for both the spring tree pollen season and the fall weed pollen season. Next slide. So what are some of the tools we have to address this growing concern? We conducted a literature scan of public health interventions related to pollen and found 5 main ways that seasonal allergies can be targeted. First are environmental interventions. This means adjusting the environment to reduce the pollen in the air, which may include planting trees or plants that do not put as much pollen in the air, such as female tree species or plants pollinated via insects. Or this may include performing maintenance on areas where pollen-producing weeds such as ragweed has flourished. Second is a raised communication and awareness about the pollen season so people with allergies can better prepare for and respond to seasonal shifts in air allergens. Communication may include an air quality alert system or email updates from your allergist. Third is immunotherapies and medication to desensitize the body's reaction to allergies and improve symptoms. Fourth is improving the indoor air filtration system. So outdoor pollens do not come inside. And finally, fifth is enhancing the health and pollen monitoring so we know when pollen is at a level that is dangerous to health and we can better target our activities and communications. I'm going to specifically now talk about some of the ways CDC is working towards that final piece of enhancing our knowledge and monitoring of pollen. Next slide. So the CDC Climate Health Program is working to make pollen information more accessible to public health departments and the general public so they can better prepare for and respond to the pollen season. We know that pollen seasons vary from place to place and even year to year. So it's important to know when the pollen season is occurring and what the major pollen species in that area are. This information equips people that suffer from allergies and their allergists to better target their treatment. So we've worked with the Environmental Public Health Tracking Program to develop a prototype of what tracking local level pollen information in real time could look like, and hoping that collaborations with organizations like the National Allergy Bureau can bring this to fruition. Next slide. So to better understand the relationship between pollen and health, a question we've explored is at what level of pollen are we seeing significant health impacts? Here is what the pollen season looks like in the spring and in the fall in Atlanta. The colors indicate the pollen levels as defined by the National Allergy Bureau. As you can see, within a pollen season, there's quite a bit of variability from day to day, which may be due to changes in the weather. Next slide. So the National Allergy Bureau has defined these pollen levels based on the amount of pollen in the air. Currently, pollen levels are defined as low, moderate, high, and very high. Because we want to understand at what pollen levels we see significant health impacts, we added a category of moderately high, if you can click one more time, for our analysis so we can see more granularity in the results. Next slide. So pollen and health data was assessed for a range of cities across different regions of the US, and this was selected based on significant population where there's health data, as well as a National Allergy Bureau certified pollen station. Next slide. So we pulled health information from the Market Scan IBM Truven data set for physician visits for allergic rhinitis and allergy prescription medication refills. And as you would expect, we found that with increases in pollen, we're seeing more physician visits for allergic rhinitis and more allergy medication refills. Though what was significant and surprising was the level at which we were seeing this increase were moderately low pollen levels. So this is important to show that early warning is something that is really important to preparing for and responding to the pollen season. Next slide. A second health analysis conducted was to see if there are signs in the health data that may give us a picture of what the pollen levels are. So pollen monitoring stations have a limited coverage across the US, so we assess whether real-time syndromic surveillance health data correlated with pollen data and may signal significant pollen levels in locations where there's not a pollen station set up. We assess that relationship of pollen to emergency department visits for pollen-related allergies, and it was found that, in fact, areas closest to the pollen monitoring station indicated by the red dot had greater correlation than areas further away. Next slide. So the CDC's Climate and Health Program funds states and cities, tribes and territories to conduct climate and health activities. I wanted to highlight just 3 projects happening across our funded public health departments that demonstrate the actions that can be taken at the local level around pollen. First is Minnesota, where the state public health department has partnered with its local pollen counting station to develop a pollen information dashboard. Second is Michigan, working to conduct an analysis looking at the relationship between pollen and emergency department visits so they can better understand the impact of pollen and target their interventions. And third is in Maryland, they're using satellite information to track pollen seasons, giving a greater geographic and temporal understanding. And this type of modeling can be used to predict pollen levels in areas where there's not a pollen station nearby. Next slide. So in summary, as pollen seasons are becoming longer and more intense, posing significant burden to public health, it's more critical than ever that the Climate and Health Program continues to foster these collaborations, both within CDC and among its external partners, to improve and enhance pollen and health monitoring. and that the CDC Climate Ready States and Cities Initiative grantees continue to implement their pollen and health interventions through partnerships across public health agencies, clinicians, and academics. Next slide. Thank you, and now on to Dr. Fineman.
Thank you, Claudia. Next we would have Dr. Stanley Fineman. Dr. Fineman is a distinguished fellow of the American College of Allergy, Asthma, and Immunology. He's board certified by the American Board of Allergy and Immunology and a practicing allergist with the Atlanta Allergy and Asthma Group. And we are incredibly grateful for the very strong collaboration that the program has had with Dr. Fineman over the last many years. Thank you, Dr. Fineman. Over to you.
Well, thank you, Shubhayu, and thank you, everybody. And let's go to the first slide. What my charge is to talk about pollen counts and how they're useful for allergists. Let's go to the next slide, please. And what I thought I would focus on would be just a little bit of a history of hay fever. I thought that might be interesting. Allergist approach to diagnosis, monitoring pollen counts, which we've talked a little bit about, Claudia did, and then utility of pollen counts in managing patients. So let's go to the next slide, please. And this is really the first description of hay fever. I mean, I kind of like to go back to history. And so in 1829, John Bostwick in England described this Catarrhus aestivus, and basically he did have hay fever. And then it wasn't until 1873 when Charles Blakely published a study that said that hay fever was attributed to pollen. And then, as everybody here who's studying pollen knows about August Thoman's postulates, his postulates were published in 1930. And the reason they're important is because they really say that that pollen does cause the symptoms. And his postulates, you can read them here. The first one was that the pollen must contain an excitant of hay fever. They didn't know exactly, that much about allergens. Certainly, IgE wasn't even discovered until the early 70s, late 69. Pollen needs to be wind pollinated. It needs to be in sufficient quantity. The fourth postulate was that it must be sufficiently buoyant. In other words, it has to be able to carry distances, and it must be. And the fifth one was that plants producing pollen must be widely and abundantly distributed. So those are his postulates, and we can talk more about them later, but let's go to the next slide. And this is how we diagnose allergies. We use a skin test technique, which is validated and very accurate and precise. We put the allergens on the skin test device, which you see on the left, and it makes a little mark in the skin. And basically, if the patient has an IgE sensitivity to the pollen, there is a histamine release. So you get a triple response of Lewis. And if you remember your physiology, and on the right, you can see a patient who had a number of positive skin tests. And in fact, this is considered an in vivo histamine release assay. In vitro would mean you would put the drop of allergen in a test tube with mast cells, and you'd measure the histamine that's released. In vivo, we do it, and it's a lot easier. You put the drop on the skin, you make a little prick so that the tissue is exposed to the allergen, and within 15, 20 minutes, you see the wheel and flare response. The larger the wheel and flare, the greater degree of sensitivity the patient has. So here you can see a patient, interestingly, A is where dust mite is, B is, and E are tree pollens, and C is grass pollens and some weed pollen. So that's what we do, and we do that every day. Let's go to the next slide. We also monitor our pollen counts, as y'all have said. We're part of the NAB, National Allergy Bureau. On the right, you can see our rotorod. We have a rotorod that's on top of our parking lot. And then we have certified counters who do the counting, and everybody knows what she's doing. So I don't have to go through that. Let's go to the next slide. And we do publish our pollen counts every day. And I think Claudia had this slide or something like that. It shows, in fact, this just shows the slide from a couple days ago. This was on Sunday when the pollen count hit 6,974, mostly tree pollens, you can see, and, a little bit of grass, but, we do this every day and publish it, and it does and we've been trying to collaborate with Shubhayu and the team there from the CDC and a number of things. And we can talk more about that as well. Let's go to the next slide. Because as an allergist, we do need to understand the floristic zones. We need to understand what is pollinating, what the patients might be exposed to. And so we stay on top of that. Here in Atlanta, we're in the Piedmont forest. So, we're aware of those allergens. Let's go to the next slide. That shows you what we do our skin tests to. We do skin test on the left. You see the trees. They're all hardwoods. That means they're allergenic. They're all, microscopic pollen. We don't test for pine pollen because it's a larger pollen. It's not as allergenic and it doesn't really trigger allergy type symptoms. It may act as a dust, an irritant, especially when it gets so high around here, but it's not that allergenic. We don't treat for that either in terms of allergy shots or immunotherapy. The grasses, you can see, these are the ones that we test for here. Y'all probably realize that Timothy, fescue, June do cross-react, but the others are more of the southern grasses. The weeds on the far right are the ones that are particular to here in Metro Atlanta and Georgia, and those are the ones that we test for and treat for. So let's go to the next slide. So this is the thing that I wanted to point this out, and it was kind of interesting because Claudia did have a slide from our pollen reporting, and I think it was like around 2011, that showed a very high pollen count in the fall. So when we were doing our pollen counts, we noticed a uptick in our tree pollen counts in the fall. So this happened to be in September, if I can read it, 17, a 116 with a really a big spike in tree pollen. Well, everybody knows ragweed pollinates in the fall. It's not tree pollen. So let's go to the next slide. And what we did is we started analyzing what exactly are we seeing, and we see that the Chinese elm pollen counts in the fall started increasing. So if you look at the concentrations of the pollen grains over that 10-year period, it started really peaking at around 2011 and 2012. And interestingly, we did move our pollen station in 2010. So it was in that area. And what we found after doing a little more delving into it was that this was a relatively new office building that we were in. And the people who did the landscaping were planting this Chinese elm because it's a very hardy tree. And so now, in fact, Chinese elm is an ornamental here in Atlanta. And I was particularly interested in, I don't remember if it was Theresa or Claudia mentioned about the impact of the different allergenic plants in the community. But here's an example where we found that the tree pollens were peaking in the fall. And in fact, now we test for that and we ask people, more about their symptoms. And so it's kind of interesting because there's probably some correlation with flare of symptoms in the fall and maybe some tree pollen sensitivity as well. Obviously, we published that in Atlanta in the Annals of Allergy. Let's go to the next slide. And this was another interesting history. Again, I'm sort of interested in history, a little bit about medical things. And y'all are probably aware of Operation Ragweed. This was started in '46 in the New York City Department of Health. And what their goal is to try to eradicate ragweed. So they figured if they could eradicate ragweed, then they wouldn't have problems with hay fever and all the problems that Claudia and Theresa were mentioning with morbidity, with pollen exposure. So they spent almost, it was $92,000. It was equivalent to about 800,000 in today's dollars. And they eradicated ragweed acreage in one of the boroughs in Brooklyn, I believe it was. Anyway, the bottom line was all around, there was no significant change, even though there was reduction in the ragweed acreage. The pollen itself did not really reduce. So if you look at the bottom conclusion, they felt that there was little likelihood that eradication campaign will successfully eliminate the weed or reduce the pollen index. So obviously, we don't try to kill the plants. And when I have patients that come to me and they said, oh, I'm allergic to oak trees. Do I need to cut down the oak tree that's in my yard? Well, obviously, they do ask me that, but obviously I tell them no, because your neighbor's going to have an oak tree. So let's go to the next slide. How How do we take care of patients? That's one of the reasons I guess I'm here, is to talk about that. We need to make an accurate diagnosis. Again, we have standardized extracts in a number of cases, and we measure the pollen and skin tests that we showed you. And I think it's very accurate. It's time and tested and proven to be accurate. In terms of avoidance, treatment plans, rather, we do recommend avoidance. Medications are helpful. The nasal inhaled corticosteroids are considered the first line drug for treatment of hay fever, seasonal pollinosis. That's been a change. It used to be an antihistamine, an H1 antagonist, but now efficacy shows that inhaled steroids work much better. And so first line is nasal steroids. Second line is H1 antagonists. And of course, second generation are recommended. Those are the non-sedating like loratadine or fexofenadine, or minimally sedating like cetirizine. We don't recommend Benadryl. It's short acting, very sedating. We don't recommend using that at all. Immunotherapy, it's one of the major ways we use to treat patients. That I think Claudia mentioned that. It's a very effective way of changing your disease. And in terms of we call it a disease modifying treatment, because patients are able to build up a tolerance to the allergen when we administer small doses of the allergen. Interestingly, we've been using allergy shots for years, very effective, good therapy. Now in Europe, in fact, they use a lot of sublingual immunotherapy. So besides using it subcutaneously, now you can use it under the tongue. It's not approved by drops here in the US by the FDA, but there are some tablets available that are prescription for ragweed and for grass pollen. So sublingual is an option for some of those patients as well. We do suggest patients who know that they're allergic to the pollen follow pollen counts and try to correlate their symptoms with the triggers. And that's really how we manage patients. Let's go to the last slide. I just wanted to show you this. This is kind of a fun slide. Mike Lukovic is our local political cartoonist in the Atlanta paper. And each year, not necessarily each year, but this was a couple years ago in 2015, where he had a little something about our pollen, which is pretty remarkable. And what he says here is, for sinning, you're staying in the Garden of Eden, where I upped the pollen count. So a little germane to some of the discussions. But anyway, thank you again for having me here. I look forward to the discussion.
Thank you, Dr. Fineman. The final presentation, we have Dr. Jeremy Hess. Jeremy is a director for the Center for Health and Global Environmental Change at University of Washington. He holds joint appointments as a professor in schools of public health and medicine at the University of Washington. Dr. Hess is a leading expert in the field of climate change and public health with a research portfolio that spans across multiple disciplines and topics. Welcome, Jeremy.
Thank you, Shubhayu. It's been a great series so far. I've learned a lot myself and been set up really well for what I want to talk about today, which is synthesizing all of this information to support decisions related to climate, pollen, and health, so we can better improve people's health going forward. And next slide, please. I'm going to focus on three aspects of this and move relatively quickly because there's a lot of territory to cover. I'm going to first introduce what I mean by decision support and the decision support space that I think we're operating in. And then I'm going to focus in on some of the tools for decision support related to climate and pollen and health. And you've seen many examples of that over the course of today's webinar, and I'm going to reinforce much of what you've heard already. And then I'm going to talk a little bit about how we might move forward. And you've heard some possibilities already from other panelists, but I want to frame that in terms of how we can advance our ability to support appropriate decisions for reducing the burden of disease associated with pollen. Next slide, please. So starting out with our decision support space, next slide, I want to answer the question of how we can minimize the burden of disease associated with pollen allergies. And to do that, we have to think through what are the different mechanisms, what are the different levers available to us to reduce disease. And we can take a more public health oriented approach, a more medically oriented approach. They're complementary. But these are the 5 areas in which we really operate. One is that we are promoting prevention of disease from developing, diagnosing it accurately and early, as Dr. Fineman pointed out, supporting surveillance of relevant exposures and health outcomes to see how well we're doing over time, reducing those exposures through various methods, and we've heard a lot about that from Claudia in particular, and then supporting approaches for deploying strategies to reduce symptoms when they occur. Next slide, please. In the public health paradigm, we think about primary, secondary, and tertiary prevention. And primary prevention is exposure avoidance. And several of the strategies that you've heard already include staying indoors when pollen is high, filtering your air, and in some extreme cases, this happened to my parents, relocation to a part of the country where you won't be exposed to the pollens that you're sensitized to, or pollens at the same level that you may be exposed to in other areas. Secondary prevention is focused on preventing symptoms once exposure has occurred. And this is where the bulk of allergy management lies. And Dr. Fineman outlined all the different approaches for this process, diagnosing and then targeting therapy, medications, and then immune therapy, as he mentioned. And then lastly, tertiary prevention. So minimizing the symptoms in patients with disease, and particularly with severe disease. And so this can be pre-medication in advance of an exposure, or medication after exposures occurred, and then rescue therapies for people who have, for instance, allergic asthma and severe disease, end up in the hospital and have to be rescued from that process. Next slide, please. So there are lots of decisions that different people are making in the process of managing their allergic disease. And I think it's helpful to think about the different actors in this process. And they particularly include patients, providers, and public health practitioners. Patients, of course, are managing a lot of their disease on their own, particularly people who don't have really serious allergic disease, and may not be candidates for immune therapy or other more aggressive sustained management. They're making their own decisions about avoiding exposures, taking medicines, and seeking medical care. And what's important here is thinking about the timing of the information that each of these groups need. Patients actually need information that occurs on the day of, or maybe slightly in advance of potential exposures. Whereas providers, as we heard, actually the timing of the information may be less important for the diagnostic process, which involves the skin testing. And then for some of the more intensive therapies like immunotherapy, the timing is also less crucial there. Of course, timing for other medications is very important, and giving patients appropriate guidance about how to avoid exposures, it depends very much on accurate information and forecasted information related to pollen. For public health practitioners, we, as we heard from Claudia, focus on warnings, expectant management guidance, and surveillance. We also think about equity around the burden of disease associated with these exposures. The information we need as public health practitioners is kind of a combination of what patients and providers need, but there's also the important question of how to do long-term surveillance of these things. We need good, consistent, generalizable indicators to support that work, particularly in the face of climate change. Next slide, please. So what tools might be available to us to advance this work? Next slide, please. We have a lot of data, and you've seen lots of examples of different types of pollen data that are collected currently. We need to continue to work to synthesize that data into decision support tools. And one of the narratives that we've heard emerge is that climate change is affecting pollen, and that's a key observation, but we need to then think through what does that mean for emergence of different kinds of pollen allergies in new places, for a larger burden of disease associated with pollen because the climate is changing, and how we can reduce those risks. So we need to start with our mental models of how pollen and climate and weather are linked, and then how that affects human disease, and then support ongoing projects and data collection and synthesis to actually support the decisions we need going forward. Next slide, please. So the core relationship for our mental model is one that links local pollen exposure, pollen counts, with weather variables, and in this case, temperature is the governing variable in most cases for pollen, and symptoms. And you can see here that there's a clear correlation between all three of those variables for patients who are sensitized to pollen. Next slide, please. And other variables besides temperature are also important. Sunlight, winds, precipitation, all factor into plant phenology and pollen release in complicated ways, and the timing is not always entirely clear. Next slide, please. Some of the work that we've done, which was funded by NASA, supported by the National Allergy Bureau, was to update the nation's pollen calendars. So this is work that Dr. Fiona Lowe and I did in our NASA grant, where we did a descriptive analysis of the pollen season for all of the cities for which we had pollen data in the contiguous United States. And you can see here, these are arrayed from northern to southern latitudes, and you can see a clear seasonal pattern that lengthens to encompass almost an entire year for the total pollen season. Next slide, please. You can also see that there are distinct patterns based on what kind of plants we're talking about, and allergists often think about trees, weeds, and grasses. So this is different taxa of trees. Next slide, please. Weeds. Next slide, please. And grasses. And you can see people may be sensitized to trees and not as much to grasses, and then again to weeds. And this kind of calendar can help them get a sense of what they can expect year on year in terms of the pollen season. Next slide, please. There are ways to increase our precision. So we know what the season is, and particularly where the intense part of the season is for different trees, grasses, and weeds. And then we also, as Dr. Fineman pointed out, have the additional support of allergy testing, skin testing. We look at common prevalent allergens in a given place and then identify what our patients are susceptible to. And we can combine that information to give them even more specific guidance. Next slide, please. And with information about each location, we can give very precise information to sensitized patients. They're more likely to be sensitized to local flora, but not always. Sometimes they are coming from other places where they've been exposed to other pollens, and so they're sensitive to other things. But we can combine that information to give increase the precision of the guidance we're giving. Next slide, please. But unfortunately, lots of places don't have the resources to do pollen observations. So we have a lot more environmental data available to us than we do pollen data. And we've been successful in developing some predictive models for pollen, particularly for the contiguous United States. There's potential also for generalizing these models to other regions, including Europe and ultimately globally. And this includes observations of weather and meteorology, also of green up and vegetation, where the plants are and when they're when deciduous plants are greening up, and then different geographic factors, and of course, plant phenology and pollen observations. Next slide, please. And you can see here in this this movie of it doesn't look like it's playing, but this is a nice spring day 2 years ago in Seattle, where it was warm, unseasonably warm, and there were high winds. And this tree released a boatload of pollen. And if you were sensitized to this pollen, you were in real trouble. And Fiona, who is unfortunately an allergy sufferer, shudders every time she sees this video. But it's a nice example of how different meteorological factors come together to precipitate airborne pollen release. Next slide, please. And some of the work we've done is trying to fill in gaps using this environmental information in order to get predictive models of different taxa in different locations that are precise and not only fill in the gaps in the observations where we're doing observations, but also allow us to predict pollen levels and pollen counts with high precision in places where they're essentially data-free zones at this point from a pollen observation standpoint. Next slide, please. So I'm taking you through several different locations and specific taxa here, and you can see that we have developed some skill in filling in data gaps with a reanalysis data set using the model that Dr. Lowe developed. Next slide, please. Our model works better for some taxa than others. It works generally pretty well for many trees. It works pretty well for weeds and for grasses. Next slide, please. Its performance also is pretty good. So next slide, please. Despite our advances in developing methods for forecasting, we are still working to figure out exactly what indicators we should be tracking to look at climate change and its impact on pollen. And we have, as Dr. Ziska pointed out, already seen that climate change is impacting pollen concentrations. And here, I know this slide's a little busy. I don't want to go through all of it because I don't have time, but I want to bring home the point that there are a lot of different parameters we can look at with pollen. And again, it matters what kinds of decisions we're looking to support, whether we focus on when the season starts, what the level of pollen is, what the max level is, how long the season lasts, et cetera. And we're seeing changes in many of those factors and metrics already as a result of climate change. We need to make some decisions as a community about which of these are the most important metrics that we'll track and prioritize and try and develop models for the entire country. Next slide, please. I don't know if this movie will play either, unfortunately, but we have developed some moving visualizations that are historical projections of pollen levels by taxa for the United States that give us a historical baseline, and we're going to be looking at projections of climate change impacts on these taxa using our models in the near future. Next slide, please. So what can we do to improve decision support going forward? There are lots of possible collaborations, several of which have been suggested here today, and hopefully there'll be some new investments in climate and health research going forward. Next slide, please. I think we should be thinking again about the decisions that different actors have to make, and then trying to get a sense of how we might fill in the shortfalls in the information we have to support each of these actors' decisions. When we think about patients and how they use and access information related to pollen to support decisions about behavior and timing of medications and other things, we need additional insights into what information is most valuable and how they prefer to consume it. We need information about how exposure is linked to development of sensitization to pollen, and then how that plays out in terms of exacerbations of allergic disease. And we need more information about different strategies and how effective prevention strategies are for reducing symptoms. And then lastly, we need more information about how effective our risk communication activities are. Next slide, please. We have a long way to go, even though our pollen data, it's all voluntarily generated, and it's a huge effort and investment of time from members of the NAB and others around the world who collect it. There are a number of gaps in the data that we have, and we need to fill those best we can and decrease the biases, in some cases systematic biases that limit our ability to detect impacts from climate change. And then we also need to develop ways to better link what we're observing phenologically and in terms of the weather and climate association with pollen with patient symptoms, which haven't really been evaluated at this point. Next slide, please. So we are working on reanalysis data sets to increase the geographic coverage of pollen data for the United States and help with exposure assessment and support a lot of this research. Next slide, please. And we are also looking at developing indicators for the Council of State and Territorial Epidemiologists, as well as CDC, to examine how changes in different pollen metrics have changed over time and what the association is with changes in climate. And these are preliminary findings. Again, Dr. Lowe is leading that project. And we've found clear signals for several different tree taxa, showing that the season is shifting earlier in the spring. Counts are often decreasing later in the season, but we're seeing different relationships for other plants. I'm looking forward to talking with you about that as well. So in summary, next slide. I advocate that we think about all of this work in terms of the decisions that we need to support for the people that we work with. And we have a whole host of different support tools, some of which are static, some of which are dynamic. And we need to synthesize this data on exposures and outcomes in order to better support all of the different groups that are working to reduce the burden of disease associated with pollen, particularly as the climate is changing and making this a much more prevalent concern. So I look forward to next steps. Thank you much.
Thank you, Dr. Hess. Thank you to all the panelists for the excellent presentations. We'll move into the question and answer sessions now. You already have sent quite a few questions in the chat box, in the question and answer box rather. So please keep them coming. Just as a quick aside, this information was just shared by Dr. Eric Svensson. He's the director of the Division of Environmental Health Sciences and Practice where the Climate and Health Program sits. And the cherry blossom season, this is a BBC News, cherry blossom season has peaked at the earliest date since records began 1,200 years ago. So we keep breaking all kinds of records for all the wrong reasons. Maybe a first question, that I had for all the panelists. We touched on the issue of equity very briefly, somewhat in a cursory manner. And, this was just an open question, whether you think exposure to pollen poses a disproportionately greater health risks to certain communities based on either way they live and or their socioeconomic status.
I mean, I guess I could start. I mean, we do see studies that show that I think, I remember if it was Theresa or Claudia mentioned about the underserved communities that are, that have a harder time getting access to care. A lot of those tend to live in urban areas, maybe by highways. We do know that children who grow up next to highways where there's exhaust fumes and particulate matter have a greater incidence of respiratory problems and even allergies. And so, they're going to be impacted a lot more by exposure to pollen and development of allergic sensitivities. I think somebody also, maybe it was Dr. Ziska, mentioned about, getting sensitized not just through respiratory, but possibly through skin. That's a whole nother route of possible sensitization that we're reading about. It's not just for respiratory or inhalant type allergens. We're seeing now that maybe even food allergies can be transferred through a skin contact. So I think it's a real concern, and we're seeing studies about that now in our allergy literature.
Thank you, Dr. Fineman. And Dr. Hess, you seem like you would want to say something.
Yeah, thanks. I'll add on to that I think that there are some important issues around equitable healthcare access that make it complicated for some groups to get timely access to appropriate diagnosis and then also treatment. And so there is often a higher rate of underdiagnosis, misdiagnosis, and therefore mismanagement and reliance on rescue therapies and other strategies instead of preventive measures that can reduce the burden of disease. And this extends not only into just the suffering of the patient who has the allergy, but also absenteeism, presenteeism, and impacts on the family. So it's a broad impact that undermines people's ability to pay attention and do well in school, and also undermines the family's ability to go to work. And so it's because of the morbidity associated with allergies, the impact is substantial on people who don't have good allergic disease management.
Thank you. Another question that came in, and it's essentially related to this issue that came up multiple times, this inadequacy of pollen monitoring across the country. With the limited network that currently exists, how can the network be expanded in a cost-effective way? And how can one prioritize where to increase monitoring? In other words, what would you consider to be adequate monitoring? How close do these monitors need to be? Maybe start with Theresa and then go to Dr. Ziska.
Sure. So I don't feel like I'm really qualified to answer the questions about adding to the NAB station network. I haven't been involved in that, but the work that I was showing was hinting at, are there other types of data that we might be able to lean on to try to help fill the gaps where we don't have that really good data that are collected in the way that the samplers collect. So I'm hopeful by the early results that we have, and absolutely excited to dig a lot deeper to see if there's greater potential that we could really try to enhance by even increasing the intensity of monitoring out there on the ground by folks who might have a vested interest in having a better sense of what's happening and how they may stand to suffer from that.
I agree with what Theresa has said. I think actually it touches also on the social economic status issue that was part of the first question, and that is we need to monitor in ways that will catch some of the differences that may occur in terms of pollen exposure and timing of that exposure. So those could be indoor allergens that may be more prevalent or outdoor allergens. My own thoughts have been to look at what Pollen Sense and other companies may be doing in terms of automatic pollen monitoring, where we have the mathematics and the sophistication to begin to do automated pollen monitoring in a way that is accurate. I don't know if we're there yet. I think we're very close. And I think that's an issue that is something that the NAB and others should start to look at more intently. Certainly in terms of the number of monitoring stations, I don't have a set number, but how many particulate matter PM 2.5 stations are there right now? Could we get at least half as many? 3/4 as many? I think that would be really useful in terms of trying to get a better sense of what is happening and how prevalent is this, and what are the different groups that are being exposed, and how are they being exposed, and which demographics and plants are changing, and so forth and so on. There are a lot of unanswered questions in that regard.
This might be an associated question. Could a smartphone-based app be used as a surveillance for pollen counts and allergy symptoms by users? Would any of you have any comments or information on that?
I mean, certainly you could measure symptoms, but I don't think you could measure pollen counts. I think that would be a challenge, but unless it's observational. But I think that there are a number of apps where people can monitor symptoms. Particularly, it's used in asthma. And now, in fact, you can even measure your lung function and oxygen level with some of the phone apps. So it's very, definitely getting sophisticated, and that could be a potential.
Yeah, and the Nature's Notebook program that we run, we ask, it's kind of like indirect questions, but I think it's probably the best thing that folks could observe that would point to pollen. We ask primarily about open flowers in most species, pretty much, that have flowers. But for some species, we also do ask specifically, do you see pollen release? And that's for junipers and a small number of species where it's obvious. It tends to be conifers. But that can also give a sense of where folks are seeing pollen out flying in the air and landing on their cars and that sort of thing. And so we haven't really pushed that. That's what I was saying about the campaigns. You know, we've really emphasized and encouraged submissions on different kinds of phenomena, but other than a localized effort focused in Texas, we haven't really tried to capitalize on volunteer observations of pollen yet. And so I think that there's a lot of unrealized potential there. And it'd be super to bring that in line with an app where folks were also reporting on their symptoms and what they're experiencing, to get that real time and spatially co-located reports on both things.
Thanks, Theresa. There was a specific question for Dr. Ziska. It reads, have read and used graphics from your Midwest study many times. Are there any studies of pollen and climate latitude changes on the East Coast? Seems to be few pollen stations in northern New England, I believe.
There are. This is touching on what we were just discussing. There are fewer pollen stations in the Northeast. The best example I can give you is in the New York metropolitan area. I'm only aware of two, one at Fordham University and one downtown. Obviously, if you have 12 million people in two stations, you could probably do a little bit better job. The transect that we had for the Midwest in terms of looking at the pollen was partly because the Midwest is known for pollen, but also because we wanted to avoid urban areas with the microclimate that could in turn affect what we were seeing with respect to any sort of larger climate signal. So while there are pollen counters along the East Coast and in the Northeast, that was one reason why, is the urbanization of those areas makes it more difficult to separate urban microclimate effects from an overall trend from global climate change.
Thank you. A somewhat sort of cross-cutting question again. Any discussions on what the appropriate spatial scales are for understanding pollen production, release, exposure, and its effects on health?
It's a complicated question, and it actually depends on the pollen and its physical properties, its weight, and other things. Some pollens are born further than others. There's been some work done on trying to model the distribution, the fate and transport of different types of pollen, and like other particles, we actually are pretty competent at modeling that. The main limitation has been a lack of information to validate the models against in lots of settings. So a lot of that work has been done in agriculture, actually, where there's some more commercial importance, less so on human health.
Anyone else would like to comment on that? So moving along, and this is somewhat relevant to the discussions around indicators that we had. Could you please comment on the analytic or conceptual choice to use minimum daily temperature versus median or average or maximum temperature in testing associations between pollen and allergy symptoms and pollen concentrations? Maybe Claudia?
Sorry, Shubhayu, you broke up just a little bit. Can you say that one more time?
So can you please comment on the analytic or conceptual choice to use minimum daily temperature versus median or average or maximum temperature when these associations are being done between pollens or pollen concentrations or allergy symptoms, vis-a-vis the weather parameters?
Sure. Dr. Ziska can probably speak to this more accurately with his recent paper on looking at the association. But I've seen papers that have looked at a range of those different temperatures, temperature indicators, and they all have similar trends, that it's not only the current season's maybe mean, max, or min, but also the previous season. So they're seeing in general, that there's this relationship that both the prior season and the current season is affecting, having those impacts on the changes in the pollen. But again, Dr. Ziska, you might be able to speak to that better.
No, I thought that's a pretty good overview, Claudia. I'll try and add a few more details. Basically, from a climate change point of view, one of the differences that we see is with respect to what is increasing faster, minimum temperatures or maximum temperatures. And I won't go into all the physics behind it, but basically minimum temperatures are increasing to a greater extent than maximum temperatures. Why is that important? Because heat accumulation, heat units are one of the factors that can be taken into account when you start looking at tree phenology. Theresa probably knows this as well as I, that it can be complicated. There can be both fertilization, that is a need for cold for flowering, but also an accumulation of heat units before flowering. So when you look at Shubhayu was saying that about the Japanese cherry blossoms 1200-year record, that reflects in part those heat units that are occurring, and the increase in units reflect to a large extent the minimum temperatures, not the maximum temperatures, because you're looking at a winter period where temperatures above freezing that occur or accumulate during that time period are associated with phenology occurring in the spring. It's not true for all trees. As I said, it's complicated, but it's certainly a factor that needs to be considered in that regard.
And on a similar vein, Dr. Ziska, do you think that there would be an upper limit as far as increasing CO2 levels are concerned about how much pollen a plant can produce? And how do you think plant acclimation could influence pollen production?
Well, I think there's a lot of variability within the amount of pollen any individual tree can produce. And one of the issues that I'd like to see explored a little bit more in that regard is related to carbon dioxide. We know that carbon dioxide is a primary greenhouse gas, but as I mentioned, it's also a stimulator of plant growth. And as it stimulates plant growth, which as I showed in the case of ragweed, that increase in growth provides a larger platform for catkin production, for pollen production. So for me to say to you right now that ragweed can only produce X amount of pollen, when I know for certain that one of the stimulators of its growth is increasing, it's gone up by 25% in my lifetime, and it's likely to go up another 50% to 75% by the end of the century. It's difficult to answer that because these things are changing in terms of temperature, in terms of CO2, and those of themselves are likely to have a significant effect in terms of plant growth and pollen production. Oh, and there's one other thing that we didn't really talk about either, and that is that CO2, we have a working hypothesis, which I guess in layman's terms is a firm possibility of a definite maybe, that as CO2 rises, that it may also have an effect with respect to allergenicity of the pollen itself. We showed a little bit of that for ragweed, but in recent years, there's been I think Dr. O and others in South Korea have been looking at this for oak and have also noted a similar trend for oak pollen, that its allergenicity also goes up as a function of rising carbon dioxide.
Thank you. There was a question, related to sort of climate adaptation strategies. While tree planting is often suggested as a strategy to reduce ambient heat, could there be unintended consequences of such adaptation strategies in terms of increasing exposure to pollen?
Sorry, I feel like Hermione Granger. Yeah, absolutely. And there's this botanical sexism. I know that's a weird term, but what happened in the 1930s and 40s was that city planners, urban planners decided they would go with male trees. And the reason they went with male trees is you didn't have to worry about that messy fruit falling on the ground and being an attraction for insects and other things. And so this has been the mindset of urban planners. We're going to plant male trees. We're going to plant male trees. And of course, the pollen from that is an issue. But there's also opportunities here you hear a lot about greening and urban greening and how important that is. And I absolutely agree. But if the greening is going to occur at the cost of putting more pollen, then maybe you should rethink that. And here's an idea that I've been trying to promote, and that is that if we can put fruit trees, female fruit trees that will provide shade, but also provide fresh produce, particularly for food desert areas within urban settings, maybe that's something we should look at. It's a twofer. You can also provide the shade, but you can also provide nutrients for folks who don't have access to fresh fruits and vegetables. Yeah, no, we'll see, but it's something to think about how we manage this at the urban level. Sorry, I'll get off my soapbox.
But Shubhayu, they're not mutually exclusive. I mean, you know, there are a lot of trees that you can plant to enhance green space that, in addition to selecting females, aren't as allergenic. And so if you're thoughtful about it, we have the information in order to support those decisions. But you need to be thinking about allergenicity, and then also making sure that the trees selected are going to be resilient to the coming climate in the places where you plant them.
That's right. You know, there was a question related to perceptions. You know, maybe Dr. Fineman and you know, Dr. Hess, you're best suited to answer this. Do you see a change in the the recognition or the assessment of the risk associated with pollen, and how much do you see that being associated with climate change among the patients that you see, if at all?
I mean, I guess I'll take a stab first and let Dr. Hess follow up. The main way that it's impacted our patients is the fact that we're seeing the pollen earlier than later. And I mean, that's pretty well, I mean, you know, y'all have all published papers on it. But the other thing that we see in allergy, in our allergy patients, is a phenomena called the priming effect. So the priming effect is where if somebody is allergic to an allergen and they have an exposure, it obviously triggers symptoms. And if the exposure goes away, let's say the temperature gets cold and the pollen count goes down, and then they're re-exposed a couple of weeks later, then their system is primed to have an even more vigorous allergenic response. And so even though the pollen count may not be as high the second week, 2 weeks after, they're going to have a more robust, so to speak, allergy response. So it's called priming effect. It's real. We see it in patients. And so I don't know, that's I think the main way we're seeing it impacting patients.
And I'm an emergency physician, so I see patients in a different context, and definitely I'm seeing climate change impacts on what presents to our emergency departments, but it's often harder for me to make the correlations with pollen, for instance, and the patients I see. I do think, in answer to the other part of your question, I think that there is generally an increased awareness around pollen and allergic disease, because we've seen it grow pretty substantially over the last several decades, and the jury is still out exactly as to why that is, whether it has to do with climate change, whether it has to do with moving away from farms and having less exposure to large animals and other things which are immunologically protective against allergies. And then, of course, we've seen big events like thunderstorm asthma events, and that made the news in Australia, where we've seen them here occasionally, but nothing like they had there, where you had a lot of people die as a result of exposure to fractured pollens during a thunderstorm, and that got everybody's attention too. So I think, yeah, as the awareness of climate change increases and the awareness of allergic disease increases, people are putting two and two together.
So we are about time. It's 2:30. I thank you again, all of you, for joining us for the webinar, and specifically the panelists for sharing your thoughts. Next slide, please, Pam. These webinars will be archived on the website of the Climate and Health Program. That's our website address. So please visit us if you would like to know more about our work. as well as what our partners across local health departments and other government agencies are doing to build resilience against climate impacts in different parts of the country. We will keep you informed as we plan on the next webinar as part of this climate and health webinar series. So thanks again for joining, and hope all of you stay safe. Take care.
Thanks.
Thank you.
Thanks.
Thank you.
Welcome.